Welcome to the University of South Carolina. I'm Rick Cates, and I'll be assisting your instructor this year with some distance learning formats. And hopefully you'll enjoy this format.
Continuing from Rick's discussion on the format, let me introduce myself. I am Mohammad Rifat Haider, one of your teaching assistants for this course, and I am going to prepare some tutorials on economic concepts which can be used to describe health insurance. And these concepts can be used to discuss the basic notions of Affordable Care Act and all other health insurance schemes and provisions that are present in US.
Welcome. I'm Rick Cates, and this is health insurance. So we're starting off on chapter 2. Let's take a look first of all at the textbook. The textbook that is assigned to this particular class is on the right. That's the second edition, Health Insurance by Michael Morrissey. The other edition is the older edition that it's been replaced. And let me give you the standard disclaimer. If you buy the older book, you still are responsible for any discussion questions, any problems that we might have that would require the new book, and you are responsible for getting with a student that has the newer book if you decide to purchase the older book. Of course, we recommend that you purchase your book at the University of South Carolina bookstore. And finally, let me say this, as far as the newer book, if you are interested in the Affordable Care Act, that's the material that's been added to the new version. So either version that you purchase, as soon as that book is produced and sent out, the material is dated, and you'll see that in a lot of slides. But let's go ahead and get started. We have a lot of material to cover in 4 weeks, so you're getting 16 weeks worth of material compressed into 4 weeks. So everybody kind of has to pitch in, everybody needs to be responsible and take ownership of their learning. And so this is going to be the layout. We'll put together an overview, but before you watch the overview, you will have read the chapter in the book and gone through the complete PowerPoint that comes with the text. And then after you've done that, you watch the overview that we're creating now. So if you're watching this overview, again, you've read the PowerPoint completely, you've read the chapter, and you've watched any assigned videos or done any of the assignments that we've put up on Blackboard for you prior to watching this video. So the other thing we've done is we've streamlined it, and we also have Rafat. He's going to come in and kind of cover some of the economic principles and give you an overview and kind of a refresher, for example, marginal utility. So if you're coming from the econ class, you're going to be solid, you'll know that material. If you're a little rusty on it, we'll give you a little review. So what is this particular chapter on? This is a review for most of you, but we're going to talk a little bit about employee-sponsored insurance, individually purchased insurance, Medicare, Medicaid, and then finally the uninsured. So let's go ahead and take a look at the charts. So in summarizing the chapter, I took all the charts from the larger PowerPoint, put them all together, and we'll kind of go over what you need to know about each chart and how you would describe it if you had it on a test or explain it. So, for example, the age distribution of employee-sponsored coverage. And so think about it. Why is that chart, is it going up and down? And if you look at 21 to 24-year-olds, you know, that's when an individual first starts working. So they're working for a company, corporation, and as time goes on to your working career, more and more employees would get insurance. So then why is it going down at 55 to 64? Well, that's probably because somebody may have taken early retirement, or they got hurt on the job and they've come out of the workforce. So then the employee-sponsored coverage starts to go down and decline in those later years. The next graph looks at insurance coverage by industry. So if you were asked to describe this particular chart, what would you say? I gave you a couple visual clues there on the slide, but agriculture is the lowest, and you think about that. There's mom and pop organizations. They're not going to provide insurance coverage for their employees. The next is service industry is the next lowest, and a lot of those employees are part-time, all the way up to the public sector, which most people are covered by health insurance. And if you think about schools and government organizations, in this particular chart, it is 87.4 in 2008. Following the same logic from the last histogram, if you look at this particular chart, again, smaller businesses from 3 to 9 people, there again, there's your mom and pop organizations. I've got a little hardware store, all the way up to larger corporations are going to have greater coverage. For example, IBM. So if they've got over 200 employees, they're more apt to have health insurance versus a smaller company at 3 to 9. And there's some rules as far as the Affordable Care Act, where there's certain cutoffs at 50, and then even smaller as far as support that the government will give to small business owners so they can help get their employees health insurance. The next chart here is a percentage of non-elderly Americans with individual coverage. So if you had to describe that one, why are the younger individuals, why do they have insurance versus some of the older ones? For example, maybe the younger ones are covered by Medicaid, or the 21 to 24. Think about some of our international students. The school requires them to have health insurance. So then you have 25 to 34. That group is the least likely to be insured. They're just starting out in their career, they're healthy, and they're putting off buying insurance. Okay, the next one is the percent of non-elderly without insurance. And it's interesting, if you think about the last chart, 21 to 24 was one of the higher groups. Well, it's still 21 to 34 is most apt not to have insurance. And this is the group that the Affordable Care Act tried to identify as ones that would take advantage, the uninsured that would purchase insurance to kind of cover the risks for everybody. And that has not been the case, and they have not jumped on board yet. This is the percent of non-elderly Americans without health insurance, and I think the large number there is kind of self-explanatory at 34.3. Hispanic, as far as the race, has the highest prevalence of non-insurance, and think about undocumented immigrants into the United States. That could be a big contributor to that. So, as you're reading through the chapter in the book and you're going through the PowerPoint, you should be looking at the facts and the comments and kind of summarizing everything together, and look for areas where there's redundancy in the presentation or in the PowerPoint, and gather all the information together, come up with the any comments or questions that you might have, and summarize it in your own mind. And that's what I'm going to do here. I'm going to go through the slides real quickly, talk about them, and share them with you, and we'll take a look at it as if you were going through and summarizing the material yourself. Here's a good example of a slide that has both content and facts. And so as you're reading through the slides, an important concept here is the CPS. You'll hear that said over and over again, and that's the current population survey. So that takes kind of a reading or a trend. It gets a feeling for how the insurance industry is doing as a whole. It lets state and federal officials understand who has insurance, who doesn't have insurance, what levels of insurance individuals have. So that's done every month, a survey on 50,000 people. Then they throw a fact out here to us and tell us that 83% of the U.S. residents, non-elderly population, had insurance in 2008. So here's an example where there was some redundancy in the original PowerPoint. If you look at this chart, the original presentation had this chart 6 times. But if you applied what I showed you earlier on the other histograms, you ought to be able to go down this chart, look at the percentages, and distinguish why it's going up between 94 to 2008, and be able to think into the future how the Affordable Care Act is going to change these figures. So, employee-sponsored coverage, it's going down. That should be a concern. You've got more employees now that are offering part-time jobs versus full-time jobs, which then is they're not required to offer health insurance. The individual level is going down from 7.5 to 6.3. So the question is, will that go up with the bronze, silver, and gold plan of the Affordable Care Act? Will more individuals then tend to purchase that? So then the next is Medicare. Think about that number's going up in terms of percentage. Think about the aging population and the baby boomers. Medicaid, those numbers have gone up too because states have become less restrictive and offered Medicare to individuals that hadn't had it in the past. Then you've got the military. It's dropping, and we recently heard that the military was cutting individuals and reducing its size, which would make sense. Then you've got the uninsured. It's still going up. Now, is that going to change with the Affordable Care Act? Those are the things that you should be able to talk about, and you should be able to look at this chart and go down the chart and explain the reasoning and the logic for the different variances in percentages. Employee coverage. Both these statements would work well for a discussion question or to elaborate in a Blackboard question. For example, 31% of firms offer coverage to part-time workers. Well, the number of part-time workers is trending up in the United States, and why is that? They're avoiding having to have health insurance for their employees. 78% of those that are covered, when the employer offers them coverage, not take the coverage. So think about this. You are going to be a healthcare manager or manager in some point in your life. What are you going to do, and how are you going to explain it to your employees when you have an employee that says, no, I don't want to have insurance, I don't want to take insurance? What are the ramifications for that, for the population as a whole, and how does that affect overall insurance cost, and what does that do to the industry? I think this slide is intuitive, kind of ties back to the original comments. Larger firms are going to have more coverage for their employees. They're also going to offer more plans, so it gives you a percentage based upon companies that are 5,000 or greater. Smaller companies, less than 200, are going to only have 1 or 2 plans that they're going to offer to their employees. So larger company, greater flexibility, more plans. Smaller company, fewer choices. This slide right here gives you an understanding of kind of what the average premiums are, what a family pays, if an employee is a single or if they have a family, what the difference is, and the breakdown, and kind of gives you a feeling for what individuals are paying out there and what it's costing to cover a family or an individual on a regular basis. All right, this slide gives you kind of an overview of what insurance companies cover: hospitalization, physician visits, prescription drugs, etc., etc. Probably in other classes you should be aware of what an HMO is versus a PPO. You should know that an HMO, you need to receive most of your care from a network provider, and they require you to have a primary care physician who is responsible for managing and coordinating of the health care, versus a PPO, that has contracts with a network of preferred providers which you can choose from. If you receive care from one of the doctors in that network, you will only be responsible for the annual deductible and the copay when you visit. Alright, in this slide, here's a prime example where I saw utilization management techniques, which I was a little rusty on, but when I went back to the book and I read through it, it made complete sense, and it reminded me of a past class. But hospital pre-admission certification is required that the physician receive prior approval to admit a covered patient to the hospital. The other one, ambulatory, this is outpatient, that they receive approval before performing a surgery. And then the other two, high cost case management and disease management, is seeing an increase overall. And why is that? So what is that? It is referred to the efforts to assign a nurse case manager to specific types of cases to ensure that the patient receives care according to the clinical guidelines. So what's happening is they're finding that this is a way to reduce costs overall, so we're seeing an increase in that. That would be another prime candidate for a discussion question or a topic later on in the course. Alright, the next is customer-directed health plans, sometimes called CDHPs, and this is where you have a higher deductible, but once you've paid that, it's pretty decent insurance. And the other thing is that you can use pre-tax dollars or tax-sheltered health savings account, they call them HSAs, to offset some of those costs. And those rules and regulations are changing. Again, another prime example of a topic to discuss later on in the Alright, these are some of the characteristics of an individual plan or individual coverage, that's not purchased through a group. And what will the Affordable Care Act do for this type of coverage later on past 2014. These are some facts and figures for Medicare that we all know is growing in leaps and bounds because we have such an aging population. Alright, this slide right here, everybody should know. This is one that I could say wholeheartedly you need to memorize every one of these parts, part A, B, C, and D. Come up with some type of naming convention to help you memorize this. But when someone says part A, you should know right off the get-go that that's hospital, skilled nursing, and home health care coverage. B is the physician services and durable medical equipment. C is Medicare Advantage, and D, I think of drugs. That's your covered prescription drugs. I know later on in the course, Rafat is going to talk about some of the donut holes that is created by D in terms of not covering all the medications, and that'll be an interesting topic. This slide looks at some of the supplemental insurance policies and the coverage. That's 2003. Notice the source, AARP. They are a provider of supplemental insurance, and this is kind of some of the information that Rafat will talk about when he talks a little bit about donut holes in the insurance industry. Alright, here's some facts and figures on Medicaid. One important component to know about Medicaid is that as individuals age and they move to a skilled nursing facility or a nursing home, they come from Medicare to Medicaid, and that is a huge expenditure for the government to pay for all the nursing homes throughout the United States. Alright, these are two of the programs that the military has, TRICARE and CHAMP VA, that covers military retirees, active duty, dependents of active duty, disabled dependents, survivors of and veterans. These are the two programs that cover those individuals in the United States. Alright, we're coming to an end of this particular chapter, but I think you kind of got an idea and a way to go through, methodically to go through the material, look at the material and make some decisions how you would answer specific questions. These are typical discussion questions that you would see at the end of the chapter. Dr. Saloom is going to try to work to create discussion questions in Blackboard that is more relative to the changes that are taking place right now with the Affordable Care Act. We appreciate your effort and look forward to the next class. Thank you.